Chief of Staff, Dr. Wesley Miller, each of whom will address you this afternoon. To begin, we will start and have remarks from our Minister of Health. Minister?
Good afternoon, everyone, and I too would like to join in the wishes of condolences and the expression of our prayers and our deep felt sympathies to those family members and friends who have recently lost a loved one to circumstances related to the coronavirus. It does appear, however, that our numbers are trending in the right direction and our active cases are decreasing. I want to thank everyone for doing their part and making an effort to stop the spread of this very, very aggressive Delta variant. However, we must not be complacent. We must not let our guard down, and we must continue to do everything that we can to avoid getting infected with COVID-19. We have completed week 38 of our vaccinations, and since January 11th, Bermuda has administered a total of 87,723 vaccinations. And of that 87,723 vaccinations given as of the 2nd of October, 52% are women and 48% are men. 84.6% of all residents over the age of 65 have had at least one vaccination, and 82.8% are fully immunized. To date, 68.9% of the population has been vaccinated with one dose, and 66.7% of the population has been immunized, namely having had two doses. From January 11th, 2021, when Bermuda's vaccine campaign began, to Epi Week 39, which ends on the 2nd of October, 2021, Bermuda's COVID-19 hospitalizations and deaths of vaccinated and unvaccinated persons are as follows. 276 hospitalizations, and that includes repeat admissions, of which 249 or 90% were persons who were not fully vaccinated, and 27 or 10% were fully vaccinated. Up until October 2nd, Bermuda has also sadly had 67 deaths in hospital, of which 55 or 82% were not fully vaccinated, and 12 or 18% were fully vaccinated. The COVID-19 vaccine still remains our very best defense in preventing the spread of the virus. It will decrease symptoms and severe illness, and in most cases, it will prevent death. We are offering free COVID-19 vaccinations at the Hamilton Princess and the Harborview Ballroom on the following dates. This week, Friday, October 8th from 3 p.m. to 7 p.m. and Sunday, October 10th from 1 p.m. to 5 p.m. Complimentary parking is available, as well as refreshments and sweet treats that are generously being provided by the Hamilton Princess. Those who have decided to get vaccinated can go to the Hamilton Princess, book an appointment, or walk into the KEMH vaccination clinic on Tuesdays and Thursdays between the hours of 4 to 7 p.m. and on Saturday between the hours of 8 a.m. and 4 p.m. Medical doctors will be at Hamilton Princess and at KEMH to answer any questions about the COVID-19 in general, as well as the importance of the vaccinations. Tomorrow, we will receive 11,700 vaccine doses from the United Kingdom, and we will begin administering boosters this week, Saturday, the 9th of October, and Sunday, the 10th of October, at the rest homes and at King Edward Memorial Hospital Vaccine Center, respectively. The rest home residents and staff will receive boosters, and those that are interested in being newly vaccinated at the rest homes will also have an opportunity to receive first doses at that time as well. The KEMH Vaccine Center has committed to, The KEMH Vaccine Center has committed to the following booster schedules. Sundays and Wednesdays between 8 a.m. and 8 p.m. and Tuesdays, Thursdays, and Saturdays will remain dedicated to first and second doses. A second vaccine center is scheduled to open the week of October 12th at the National Sports Center for persons 65 years of age and over. Persons are eligible for the booster vaccine after 6 months of their second dose. In addition to the rest homes, we will begin our booster rollout with those who have the highest risk of getting infected, which are the immune suppressed persons. Immune suppressed are those with underlying conditions that make them highly at risk of severe illness if they were to contract COVID-19. The following categories for the rollout will be those that are 65 and over, and then healthcare workers. The rollout is designed to ensure those that are vulnerable and those that work in high-risk environments are a priority for the booster shot. In addition to starting boosters at the rest homes, an antigen testing program is in its final stages of development also for our rest home staff. This additional screening, along with the booster deployment, will provide more tools to effectively assist in mitigating mass outbreaks in our rest homes. I will remind residents intending to travel to the United Kingdom who have been fully immunized in Bermuda with the vaccine Pfizer, who do not wish to quarantine whilst in the UK, you can request a proof of UK vaccination confirmation letter. The letter is a UK government requirement for all overseas territories, which verifies that you have received a vaccine prescribed by way the UK vaccine distribution program. You can generate the letter yourself by going to www.gov.bm/vaccine-certificate. The process is quick and simple and similar to the way in which you would self-generate your safe key. The UK vaccination confirmation letter cannot be generated for residents who have had their doses overseas or those who have received a vaccine type other than Pfizer. Using this process requires an email address tied to your local vaccine record. Those who cannot use the automated process can call 444-2498, option 2, to request to have the letter generated, but there will be wait times associated with using this option due to the high demand. Requesters must be ready to provide their passport number to generate the letter. Finally, just a quick reminder that the Ministry of National Security, the Bermuda Police Service, and the Ministry of Health have introduced fixed penalty tickets, which allow for police officers or a public health compliance officer to enforce the COVID-19 regulations to issue on-the-spot tickets on any individual, business, or organization in contravention of the law. The fixed penalty tickets are almost identical to the standard traffic tickets and filled out in the same way. A person will be invited to sign the ticket and will then be given the summons portion, which contains information on where to pay the $500 fixed penalty at the Hamilton Magistrates Court. Another matter I want to raise before I end is that due to the sheer number of cases, we require the public's assistance in contacting close contacts to reduce further spread. Please provide an email address on your COVID test booking if you want to benefit from the speedier automatic notification process. We all must work together to help stop the spread of this virus throughout our community. When a test result comes back positive, persons will be notified via the email address provided on their test booking. The notification email will include necessary information on the steps the person who tested must take concerning isolation and other matters. It will also include a link to an online form that allows that positive person to list their close contacts to be notified about their exposure without disclosing who the positive person is. Please remember, we must all do our part to help to stop the spread of the coronavirus. Continue to follow public health guidelines, wear a mask, practice good hand hygiene, maintain physical distancing, and download the We Help Bermuda app. Thank you. I'd like to now turn over the rest of today's proceedings to the Chief Medical Officer. Dr. Ayo?
Right. Good evening, Bermuda. I will be sharing a couple of slides today, and basically what I'll be talking about in a few minutes is basically sharing some of my insights into the vaccine booster program, and also talking a little bit about our outbreak and some of my insights about that. So if that's okay, I would start sharing as long as I can get this to work. Okay. Right. Thank you. So As I mentioned before, it's going to be a little bit about the vaccine booster and also a little bit about our outbreak. So why are boosters important? There are a lot of studies that shows that like all immune response after vaccination, and indeed after after infection, the amount of protection that the body has decreases over time, and the body is less able to defend itself against the same infection or variants of the same infection over time. The data that we've seen from well-conducted studies shows that the booster increases immunity for people who finish their primary course of vaccination, that's having the first and second dose from 6 months after the time. And with the improved immune response that you get from a booster shots, there will be increased protection for against COVID-19, and including what we expect to find from the Delta variant and other types of variants. So basically, if you have the first shot, 3 weeks later you have a second shot. After 6 to 8 months after the last shot, a booster increases the immunity that people get. So who gets the booster? It's not really for everybody, and I'll show you why that is the case in a few minutes. Basically, it needs to be for people who've had their initial vaccination after at least 6 months, as I've mentioned earlier on, and the people who have been shown to benefit from this the most are people who are 65 years or older, and people who are have underlying medical conditions, people in long-term settings, and also people who live or work in high-risk settings. So this slide shows what the number of people we need to vaccinate to prevent one hospitalization or infection over a 6-month period. So we need, if we look at people aged between 18 and 29, we need to vaccinate almost 9,000 people to prevent 105 infections and 1 hospitalization in this age group. For people aged between 30 and 49, we need to vaccinate well in excess of 3,000 people to prevent just about 100 infection and 1 hospitalization. For people aged between 50 and 64, we need to vaccinate just over 2,000 people to prevent 139 infections and 1 hospital infection. For people aged over 65, we need to vaccinate just under 500 people to prevent 125 infections and 1 hospitalization. So you can see that the maximum benefit is for people aged over 65. So why do vaccinated people still get COVID? This is data based on Public Health England data on infections, and this shows us what basically happens. So if you have 1 million people that where you have 70% fully vaccinated population, that means you have 300,000 people who have not been fully vaccinated, and the chances of them getting symptomatic COVID is about 2%, roughly speaking. Obviously varies with different variants. You end up with 66,000 people infected with COVID, and of those we expect that about 600 would need to be admitted to hospital. If you have 700,000 people who are fully vaccinated in a situation where you have 70% of the population fully vaccinated, because of the extra protection offered with the vaccines, you expect to get about 2,800 people infected with COVID and 84 people admitted to hospital. So even though the numbers look close, actually the proportions is a lot higher for the people who have not been vaccinated. What happens if we manage to get 92% of our population vaccinated? The number of people admitted to hospital in the non-vaccinated group will become, it's much smaller for everybody. It will be 160 admitted to hospital and 110 admitted to hospital for vaccinated people, and non-vaccinated people will be 160 admitted to hospital, smaller for both people. However, the number of people with infected COVID will be higher in the vaccinated groups than the unvaccinated group. And that, but if you flip that as a proportion, it is actually much, your risk of getting infected is still much higher if you're not vaccinated. This is also a point I think is important to emphasize because I've seen a lot of people talk about risks and it's important that we conceptualize the risks with COVID. The most important things that are determinants of whether you have a poor outcome for COVID is A, your age, and B, if you have any comorbidities, if you have any chronic conditions that puts you at risk. So what the vaccine does is that it drops your risk of getting poor outcomes. We've said this on several occasions, that it drops your risk of getting poor outcomes from COVID. And this, some clever people have aggregated large data sets. And again, this is from Public Health England data, and said that the drop in risk for an 80-year-old who's been fully vaccinated is now, will drop to the risk of a 50-year-old who has not had any vaccination and who doesn't have any chronic diseases to worry about. So what the vaccine does for us as a population is actually very important to talk about. So what does the Bermuda, what is the situation in Bermuda? The Bermuda Advisory Committee on Immunization Practices, as basic advice, is that mRNA vaccines are recommended for boosters. Alternatives will be offered if you have confirmed allergies. Boosters are recommended following what I have just described after 6 months of primary course of vaccination for COVID-19. And the target groups that we will be looking at will be people with immunosuppressive conditions, people who have chronic diseases, older than 50, healthcare workers, essential workers, the homebound, long-term care, and the homeless. So this is, the minister talked about the rough timetable that we're working on, and this is basically what we're looking at. We'll be getting more vaccines from the United Kingdom tomorrow, and we will be stepping up the vaccination program for these groups, as the minister has already mentioned. But it's important to emphasize that the best outcome for us is to get more people have their primary vaccination. So the first and second doses, that is important, and we will not be stopping that during this process. We'll be expanding that as much as possible to get as much people as possible vaccinated with their first and second doses. So that's what's going to happen. Again, this is a slide that shows the risks of hospitalizations and deaths, unfortunately, when people looking at the data for Bermuda specifically, and the minister has talked to this, 90% of all COVID-19 hospitalizations since vaccines became available have been in people who have not been vaccinated, and 82% of all the deaths that have happened since, of COVID deaths that have happened since vaccines have been available, has been in people who've not been vaccinated. So this is our epidemic curve. You will notice that we've had 4 successive waves, and each wave is getting increasingly worse than the previous one. This is what we have been seeing on Ireland. We're hoping that we've seen the back of this outbreak. There is still a small risk that things can change, particularly with schools reopening and some of the restrictions being lifted. There is still a risk that things can go up, but we're hoping that that does not happen. What we have seen so far is that when you have a population that remains unvaccinated, you will have a susceptible population, and if a new variant enters that population, basically, and it gets established in that population, the infection rate increases significantly because of that. What the other point to make is that the people who are relying on previous infections, actually, there have been a lot of examples of people who've been infected in every wave that we have seen. So it's not, a previous infection is no guarantee that you are completely protected. The important thing to point out, as I have on several occasions, is that your immunity following a previous infection depends on how sick you are. If you're not very sick, then you probably don't have a lot of immunity to this virus. And in any case, having the vaccination on top of a previous infection supercharges the immunity that you have. So we really hope not to see a 5th wave, but if we do, the driver for that will, I can almost predict that will be as a result of people who are not vaccinated. And as we have seen from previous waves, things tend to get worse with successive waves. So we're hoping that this doesn't happen, but if it does happen, the driver for that outbreak will be people who have not been vaccinated. So I just briefly like to talk about antigen testing before I finish. The policy for antigen testing has now been published, and that is now available. And colleagues in the Bermuda Health Council has also published their guidance on what will be acceptable for use. A couple of laboratories have been accredited to provide antigen testing as well. The key thing to mention is that antigen tests are less sensitive than PCR tests, and public health actions are based on PCR tests. So antigen tests work best when the viral load is high, and they can be used, if used properly, and that's used frequently, as a screening tool. If you have a positive antigen test, that will be followed on by a PCR test, and the public health actions will follow the PCR test. So if you have a positive PCR test and you then do an antigen test that tells you are not positive, that does not negate what you get from your PCR test. It's important that I stress that, because the public health actions that keeps us all safe is based on the PCR test. So I'll stop there and pass over to my colleague, Dr. Wesley Miller from the hospital.
Good evening, Bermuda. I must join the Premier, the Minister, and Dr. Ayo in expressing condolences to all the families who have lost loved ones due to COVID. We are particularly grateful to those who have helped us in many ways to protect the BHB when we seem to be at the point of being overwhelmed. We still have challenges, but happily things are moving in the right direction. We have gone as high as the high 60s in terms of the number of patients in hospital. Today, the number is significantly lower, but still more than it was at the peak of the previous wave. So it put things in perspective, as Dr. Ayer would have shown from his graph, that this first wave, the second, the third, and the fourth wave was a giant compared to all others. But the good news is that we're now seeing for the first time over the last week that COVID discharges are more than COVID admissions. So we had 31 admissions for COVID in the past week and 41 discharges. So that's good news. On the other hand, the admissions to ICU still continue to outpace discharges from ICU. The overall number of patients we have in the intensive care unit is less than, say, a week ago, but only slightly so. And we're still in the position where we have to use not only the main intensive care unit, but also the satellite units that we created. It must also be pointed out that the intensive care unit is there not just for COVID patients, but for other very ill patients. So at the present time, in addition to dealing with COVID, we have other very ill patients to deal with. In terms of the impact on staff, again, we can report a somewhat improved position. We still have challenges. We still have to rely on the operating theater staff, those from PACU and the perioperative area, being available to run the satellite ICU, as well as helping in the main ICU and in other areas. So we expect that to continue, certainly for a little bit longer. Exactly how long, we have to watch the trend, because when school reopens, we could see some further adverse movement. Hopefully not with the things being put in place, but one has to be prepared and be nimble in being able to adjust to new situations. Our staff vaccination continued to improve. Unfortunately, I don't have the updated figures today, but the last week we were at 76% of our nurses fully immunized and 4% were in the process. I would expect that most of those would have completed. In addition, I can report that we've noticed increased lines for people coming to have the vaccine for the first time, and some people from our hospital were among people having the vaccine for the first time as well. So we're seeing an uptick in the population, certainly in terms of the vaccination center at BHP, and that is good news. There are still areas where we would like to see further improvement, but the trend is in the right direction. You may also have seen in the press that we have had to make a temporary adjustment to the scheduled weekday times of the Lamb-Foger Center, so that instead of opening at 2 in the afternoon to 10, the opening will be from 5 to 10. That started on Monday, and certainly we will be reviewing that decision on the 18th of October. That temporary reduction is due to the fact that we need to position the nursing staff here at BHB. However, the physicians there are still working, but they're working by doing remote consults and follow-up for the period between 2 and 5 o'clock. So they still offer quality care and advice, and are there to listen for people who may have concerns, and they will advise as well as document and log those calls. And on a separate note, I would be remiss in not mentioning that while we talk about COVID and the physical aspect, we should also remember the mental strain that it caused on all members of the society, the patients, their relatives, as well as the staff who look after them. And this week in particular is Mental Health Week, so no better time to remind the public that should they have concerns or if they're stressed, then there is help available, and certainly BHB has a 24-hour hotline. The number is 239-111. And in the worst case scenario, we also will be happy to see them at the urgent care center or at the emergency department. We do expect that a significant number of people will experience anxiety and depression. They should not see it as being weak. Too often, folks are reluctant to seek help, especially where stress and mental issues are concerned, because they fear that they may be criticized or there may be some stigma. There won't be any. It is expected, and help is available. And I would urge those so affected to use the help and talk to us, because we certainly care and we understand. Switching back to other matters, one must remind the public that although we have been snowed under with COVID, and COVID seemed to be the major consideration, we are open for business and would be rather concerned if people stay home because of fear of coming to the hospital or believing that we cannot cope. We have made provisions, and so whether it's chest pain, abdominal pain, or whatever serious illness, give a call, come down to the emergency department. We have staff ready and willing to assist. In terms of worrying about the risk that if you come to the hospital, you may catch COVID, which I understand is a concern that some people have, let us assure you that we have adequate protocols in place, and the chance of that happening is very, very small. So don't stay away. Whatever the concern, COVID or not, we're here at BHB to help. I must say a special thanks to all the members of our staff. The housekeeping people have done a tremendous job and continue to do so. Our security staff have also been doing a wonderful job. We can't thank the nurses enough. And of course, our physicians have done their bit. But even all of that would come to naught were it not also for the other folks who you don't see all the time, who make sure that the IT and the plumbing works, and that all the various things that Biomed has to address will be done, and that the pharmacy people who make sure that we're adequately stocked, and they're also there to provide education for others. So we still offer a comprehensive service, and we greatly appreciate every member of staff for their participation. We also appreciate the cooperation of the public and certainly must express thanks to all the businesses that have been helping and assisting with food, others who have been contributing to the vaccination program in different ways. And certainly that has not been taken for granted, and the appreciation is certainly there, and the staff would like those individuals and organizations to realize that we do appreciate their consideration, their thoughtfulness, and their kindness. Thank you very much.
Thank you, Minister of Health, CMO, and Dr. Miller for your remarks this afternoon and for your continued hard work and dedication to helping our country through this pandemic and this current surge of the Delta variant. Thank you also to your teams at the Ministry of Health, the Office of Chief Medical Officer, and the King Edward Memorial Hospital. Your teams have been on the front line from the very beginning and continue to work tirelessly in service of our country, and we remain grateful for all the work that they do. We, the people of Bermuda, can assist their hard work by doing our part to contain this current outbreak by following the public health regulations and protecting ourselves in the best ways we can. This includes the basic methods, which we have all known from the very beginning, such as washing or sanitizing your hands, maintaining proper physical distancing, and wearing a mask when you are not able to physically distance. Our primary goal as a government remains to get students back in the classroom as soon as possible. Pre-return testing has commenced this week with preschools and primary schools that have received over 80% consent from parents for their children to be part of the regular saliva screening program. The schools that have been tested this week include Lagoon Park Preschool, Southampton Preschool, and St. Paul's Preschool, which were tested on Monday. The ministry is currently communicating with parents and staff to have these schools open on a staggered basis, beginning as early as tomorrow. Gilbert Institute, West Pembroke Primary School, and Port Royal Primary were tested on Tuesday. As of yesterday, East End Primary, Purvis Primary, Victor Scott Preschool, Prospect Primary, and Success Academy Roberts Avenue reached 80% consent and will be tested starting tomorrow, Thursday, the 7th of October. This means it will have had 33% of our schools that have exceeded the 80% saliva screening consent tested in preparation for return to in-classroom learning. Once a school reaches over 80% consent, testing is arranged. The results and data received from the test will help to determine when a school can return to in-classroom learning. The schools are aware of those who have not yet signed up for the regular saliva screening and are making contact directly with parents to discuss. Parents would like to know the consent level of their child's school are able to contact the school principal directly. We can all assist our students and teachers by doing what we can to contain this outbreak, to get our schools back open and to keep them open safely. Vaccinations remain one of the best and most effective ways we can protect ourselves and others. I am grateful that we continue to see an increase in registrations for the vaccine. As the more people who get vaccinated, the more community protection we will have against the highly contagious Delta variant. We did see a presentation from the Chief Medical Officer earlier, which certainly outlined some of the data surrounding those matters. If you have questions or concerns, or if you are considering getting the vaccination, please speak to your doctor and discuss if it is medically safe for you to do so. Along with vaccinations and following the basic health guidelines, we must also ensure that we follow the regulations which are currently set out in law. The 12:30 a.m. to 5 a.m. curfew remains in place. Large group gatherings of more than 20 persons require a large group exemption from the Ministry of Youth, Culture, and Sport, and they also require the use of SafeKey for all in attendance. Since the introduction of the latest regulations during this outbreak, large group events which take place indoors have not received approval. That restriction has now been removed, and indoor events will be reviewed and approved in line with the policy for large group exemptions. Further, the Minister of Youth, Culture and Sport, the Honorable Ernest Peets, also advises that sports is moving to stage 3 of return of play, which is competitive training to prepare for competition. I can also report that the ministry has informed the Bermuda Football Association that it has been given the approval to recommence the football season on October 23rd. The government, alongside with the Bermuda Tourism Authority, is continuing our work in spreading the message that Bermuda is a safe place for those who wish to visit our shores. We are also working collaboratively to build back the business that we have lost in our tourist sector due to the recent surge, as well as securing new business that will benefit those who rely on tourism income for their livelihoods. As the Minister of Health stated earlier, our metrics are all moving in the right direction, but our hospital is still in a critical state. Further progress will require us all to do our part and accept personal responsibility for doing what is necessary to protect ourselves and our families. Each of us plays a critical role in our efforts to reduce the further spread of the coronavirus, protect our healthcare system, get students back to the classroom, and to protect our most vulnerable. Our sense of community must be as strong as ever. We must look out for one another and continue to take the necessary precautions to keep ourselves, our family, and our friends and our neighbors safe. We must continue to rely on our resilient Bermuda spirit, which has been tested time and time again over the last 18 months and is not withered yet. I know it is hard to envision a future when there is so much pain in our community, but we must as a country move forward with a sense of unity and togetherness. I now look forward to any questions from members of the media.
Thank you, Premier. We'll start with TNN and Trevor Lindsay. Trevor? Premier, we'll start with...
Yes, good afternoon. Good afternoon. Can you hear me?
Good afternoon.
Thank you much. Trevor Lindsay, TNN. My first question is for the Chief Medical Officer, Dr. Ayo. Doctor, there are rumors being spread on social media questioning your qualifications. It's causing some concerns in some sectors. We know that these rumors are false, but could you provide some reassurance to those that may have great concerns?
So Trevor, could you educate me? What rumors are these?
Oh, you didn't see the rumors? The rumors that your qualifications as an MD is not correct. You've done 10 years as a treasurer in your home country. You didn't see the rumors. There are a selection of about 5 pictures on social media challenging your qualifications.
Well, I really don't spend my time listening to things like that. So if anybody wants to question my qualifications, let them say it to my face. I would have an answer to them when they say it to my face. I don't know what you're talking about, unfortunately.
Okay. My next question is for Dr. Miller, and let me declare my interest as I am affiliated with this facility. But there are great concerns in Bermuda as to why the hospital, and can you explain the process to why doctors in ICU are inducing comas for individuals? And what is the process? What is the percentage for those that have survived this process and to those that have passed from this process? Dr. Miller.
Okay, Trevor, my apologies. My thing was muted and it just wouldn't unmute. Now, very interesting question because I'm not exactly sure where that came from and how it came about. Because in practice, what happens, and if you're referring, I take it in relation to COVID?
Yes, sir.
Yes, yes. I just wanted to be sure. What happens in practice, the patients with COVID who end up being intubated, and I presume those are the ones that people are talking about being in a coma.
Yes, sir.
The patients who end up being intubated are patients who meet certain criteria, and also these are patients who would have been set out for resuscitation, because you know some people will have it written down prior to coming to hospital that if A, B, and C happen, they would not want to be intubated, or they would only want resuscitation to a certain level, or they may not want it. So those people who said they wouldn't want to be intubated no matter what happens, one would respect that, you know, whether we agree or not, we would respect that. That's their wish expressed. Now, to come to the other category, you get some people who eventually they get so sick. And in relation to COVID, one of the things that happen as the lungs, it affects all the different systems in the body. But the big problem is that oftentimes you get the lung, what you call like a snowstorm. Both lung fields, all the tissues affected by a pneumonia. And it's not a bacterial pneumonia, so antibiotics don't work. That's a more common pneumonia we see. And that one tends to be just one-sided, and in fact, tend not to involve a whole lung, just part of a lung. But in this case, in COVID, the unusual thing is very often both lungs widely involve the lung field like a snowstorm. So they get to the point in some cases where you give them as much steroids, a dexamethasone, you'll give them some remdesivir, you'll give them other things, and high flow oxygen, because a high flow oxygen is very good. It has been a game changer along with the dexamethasone. Notwithstanding doing all of that, you get some people who you put up to a maximum 15 liters per minute, but they cannot sustain an adequate level of oxygen in their blood. So when they get to that situation where they just cannot breathe what we call spontaneously, to maintain that even at giving them that high level, it is those individuals who, depending on the wishes that they had expressed before, who would then, some of them qualify for intubation, because what the intubation does now is that the machine takes over the breathing. You're still giving them a lot of oxygen, you're still giving the dexamethasone, you're still giving all the other medication. Now, what happens with COVID, remember I said that it affects a number of other systems. It affects the brain, and so you can get multiple little clots. We refer to them as multiple emboli. So it blocks off different areas in the brain. But it's also knocking the kidneys, because the kidneys get into trouble in more than one way. As the respiration decreases and the heart begins to fail, one, you can't get enough blood to the kidneys. And two, the oxygen supply in the blood is too low, what we refer to as the oxygen saturation. So that falls too low. So when those things happen, you will get kidney damage. Now, depending on the extent, what you will find in many of these patients, they will get such severe kidney damage that the kidneys can no longer clear all the various things from the body. You know, the kidney is very important to clear all sorts of toxins. So then some of these patients, we will then have to put on dialysis. And you will dialyze them to get certain things out of the blood and to get certain substances back within normal limits. Now, of those patients, now you're talking about very, very sick patients. So when you're in that situation, some will survive and some won't. But it's difficult to have a yardstick at the beginning. Say if you intubate, for argument's sake, 5 patients now, at that time you're doing your best. You know not all of them will make it because each individual responds in a different way. Last week, as we mentioned, that it depends too on what we refer to as the comorbidities. So if you take a guy who is 65 or 70, who had a bit of heart disease to start with, is diabetic, has a few other things going on with him, may even have had a transplant because the kidney had failed before, so you give him a new one. And he's on a lot of medication to prevent it being rejected. Now, a chap like that has less chance of a good outcome than somebody else who was an otherwise fit 40-year-old who is not overweight. But on the other hand, a 40-year-old who is really massively overweight will also have more problems than, say, a 45-year-old who is normal weight and nothing else happening. So there are various factors at play, but the decision as to whether or not they get intubated is based in the main on the person no longer able to maintain adequate levels of blood oxygen when you give them the maximum amount you can give via face mask or nasal cannula or the high flow system.
I don't know if you can provide the percentage of those that have survived to those that have passed. You probably don't have the numbers there, but
no, unfortunately, I don't have those numbers.
Okay.
At my fingertips. We
Okay.
do
Not a
know,
problem.
however, that when someone with COVID gets to the ICU, you have entered a very dangerous phase. We're extremely worried about someone when we transfer them to the ICU. So it's a sort of thing that you put all the measures in place, but whether it is here, because the other thing I tell people is that we're closely affiliated with Johns Hopkins Hospital in Baltimore, USA. And so we collaborate with them in terms of treatment protocols. Okay. So, one may think we're just acting on our own, but not at all. We collaborate with the best, and we certainly get their advice and input. And they've been very cooperative in terms of helping us. In fact, I must tell you that myself visited them towards the end of June to have long and detailed discussions with them to further enhance the collaboration that we have. So we aim to give people the very best, but when you get to ICU, you're in a serious state.
Thank you. Thank you, Dr. Miller. That was good clarification for those that are listening. Before I go to my final question, just a statement for the Dr. Ayo. I will email you that there's messages that are on social media so we can get some clarification from you on the next press conference. My final question for Premier Burt, since you spoke of the tourism product, can you provide an update on the latest, if the renovations at Fairmont Southampton is going to start, or is it going to end up like the Club Med facility, because there are some serious concerns with that facility? Can I get an update, sir?
There's no further update to provide further than the last one on Fairmont Southampton, and the government continues to work towards getting that project restarted. I will just say, if there's not time to come back to the questions, I would just personally think that the Chief Medical Officer has dedicated an incredible amount of time to the work and efforts and he's doing. And the fact that persons would try to disparage him and other persons speaks to a bigger challenge in our community. And I think that what we need right now is certainly a sense of unity and not an attempt to try to attack persons who are working hard on behalf of people. So I sincerely hope that the dignity of these press conferences can certainly be respected in that regard. And Chief Medical Officer, I'm sorry that you had to endure that today.
Yeah, I appreciate that. And as I stated, I know these rumors are fools, but I just want the clarification because of the
Trevor, we can move on, but if you know that they're false, I don't know why we would raise them and give the
Thank you,
dignity
Trevor.
of them.
I have to ask a
Thank you,
question,
sir.
sir, but thank you. Yeah.
We're gonna have Don Burgess now from Bermuda Broadcasting.
Good evening. Dr. Miller, Bermuda Broadcasting has heard from frontline staff at the hospital who are exhausted and in some case traumatized after the past few weeks. The staff are clearly doing their utmost to care for so many very sick patients. And yet we have seen approximately 40 people lose their lives recently. Other first world countries with advanced healthcare systems and similar vaccination rates are not experiencing such a high percentage of deaths in their populations during this Delta wave. And so we've begun hearing criticisms that senior management at BHB were too slow and did too little too late in August and early September in reacting to this fourth wave that was building. How do you respond to these criticisms from your own staff?
Thank you very much, Don. I'm not aware of those criticisms from the staff, and if they could find things that we could have done better or different, I'd be happy to listen to them. One of the things that one can assure you is that we have been watching and be very proactive. We were encouraging our staff and the population at every opportunity to get vaccinated. BHB, in fact, set up vaccination centers, and our staff volunteered in large numbers to run clinics on a Saturday and a Sunday because we were keen on having that preventative part, because that's the most important part of the management, the preventative piece. And unfortunately, it's the sort of thing that some people made their choice, which we respect, not to get vaccinated. And that played out with certain consequences. Notwithstanding that, BHB, for instance, well before the numbers surge, and that's why I could reassure others that we can manage, we made sure that we had enough ventilators. In fact, we have 30, and we didn't anticipate that we would need so much, and we didn't, but it was in order to have reserve capacity. What many of the people who may say things may never know, we doubled our oxygen capacity, and had we not done that, we would not have been able to look after many of these very ill patients. But we doubled our capacity, so we were in a position not only to have enough oxygen that we didn't run out, but we were able to assist nursing homes and to assist others who needed oxygen, including even vessels at sea, which were not Bermudan vessels, passing and they were in trouble. We were able to meet our international maritime obligations because of our contribution. In addition to that, we made arrangement with respect to staff and leave so that we quickly positioned things so that we managed the leave, and our staff were very cooperative so that we were able to have our staff on island. But you have to understand, and these are the sort of things that people sometimes may not realize, our normal intensive care capacity is for 8+1 patients, with the understanding that you don't ever want to have it full, because you want to be in a position that if there's a road traffic accident with polytrauma or somebody deteriorate for whatever reason, a heart attack, we can look after them. In anticipation of the surge, we commissioned not just one satellite ICU, but two, so that we more than doubled the capacity. Not only that, well ahead of the peak, we took a decision that in terms of getting nurses, we had an internal resource. The nurses in the operating theater and the perioperative services, they're highly skilled. They can do just about anything. They're well-trained. And so we closed down the elective services so that these resources, these valuable nurses and other staff, would have been available to man the main ICU as well as the satellite ICU that we have. And to this day, they're doing that. And that's part of the reason why we have not yet restarted elective surgery. And certainly, we're not going to start that before the middle of the month. And on the present show, because we still have a number of sick COVID patients, on the present show of things, we're unlikely to be starting the full flow of elective surgery until the end of this month, because we want to make sure that we position ourselves to deal with the emergencies. Even now, for instance, we're aware that schools will be reopening. And whereas the expectation is that with adequate provisions in place, we should not see a surge, but we have positioned ourselves so that if there's another surge, we can deal with it. So if others have suggestions as to how we could do things better, I would be happy to listen, and I'm sure the executive would listen. But a lot of things went on behind the scenes in the planning that some folks may never think about or be aware of.
Okay, thank you, Dr. Miller. Mr. Premier, we are seeing vaccine mandates taking shape around the world, even in common law countries. Yesterday, the Cayman Islands passed 2 bills mandating vaccines for certain persons. The Cayman Attorney General said their bills are constitutionally sound and would withstand legal scrutiny. All members of the Cayman government voted in favor of the 2 bills. Is there anything that would cause your government to change its opposition to vaccine mandates, particularly for staff and residents in nursing homes or staff working at the hospital or teachers in schools?
Don, I think it's convenient when you spoke about the Cayman Islands, you said for certain categories of persons, and then you went to the categories that some may have suggested here. I think the Cayman Islands law applied only to those persons who are non-Caymanian and to their work permit holders and others. The position of the government at this point in time has not changed. The view is that we are going to continue to allow personal choice in this manner. When you pass laws, you start criminalizing people. And so we need to examine this issue fully. What I would state is that I would hope and I wish that every single teacher, every single healthcare worker, every single person inside of those places, in addition to every single union, would elect to get vaccinated, those who can. But there are many people who may or may choose for whatever reason not to do so. The Minister of Health has spoken about what we're doing with the nursing homes to ensure that we're doing antigen tests for employees to ensure that we can reduce the risk there. And we're going to continue to do what we can to make sure we reduce the risk. But at this point in time, the government's policy has not changed in that regard.
Okay, so the first part of that question was, there anything that would cause your government to change its position? So like if deaths increased to like 100 people per week or 50 per week, that wouldn't make a difference?
I think I've answered the question now.
All right, thank you. I'd like to follow up on that question. The Cayman AG, Samuel Bolgen, speaking yesterday about the new vaccine legislation, said the more community spread continues, the greater urgency on the government to have mandatory vaccinations. He said there was no question there was a pressing social need and sufficient justification for the government to introduce mandatory vaccinations. He added that it was their government's view that the vaccination measures being introduced are quite reasonable and represent a proportional response to what is now clearly a daily growing problem that needs to be tackled head-on in the most aggressive way. He finished by saying, there is no room for wavering, no room for dithering. Mr. Premier, we've seen dozens of Marines dying recently, far more than in Cayman, yet they are taking a stronger approach. Is your government's position on vaccine mandates based on culture and politics rather than science and public health?
Well, I don't know if it's a question of science and public health, but it's a reality that we still don't even have a place where we can require students inside of schools to have a saliva test. So there are different rules that apply, and different people may take different approaches. I'm not going to get there. I mean, we have to remember that the Cayman Islands is the only country in the world now that New Zealand has abandoned it that has a zero COVID policy. That is their policy. We have ours, and we certainly recognize that we would love to have certainly not have had this surge, and certainly would not have seen the death of which we're seeing. But I will just refer to you to the position again, and we'll continue it. That at this point in time, the government of Bermuda will continue to rely on education. We'll continue to make sure that we provide the avenues for persons to get the vaccine. Because what you must recognize is that when you talk about vaccine mandates, you are then criminalizing people and giving them a criminal record for something which they may choose to do or not to do. And so that is something that has to be examined in a very strict manner. And so from the perspective now, our policy has not changed.
Thank you, Don.
Thank you.
Very much. We'll now take questions from Maya Palacio from Media Meyer. Go ahead, Maya, you're live.
Good evening, everyone. Sorry, Maya Palacio here for Media Maya. My first question is for the Honorable Premier. It's more of a reclarification. Persons have been asking for more clarity on, is Bermuda exempt from the mandate vaccination travel to the United States?
I don't believe so, but I don't actually have clarity on that. I haven't actually examined those rules. As you would know, I'm vaccinated, and so I haven't inquired as to what may be required to travel to the United States if I wasn't. But I would strongly recommend you address that question to the U.S. Consul General, and they can get a response for your readers.
Thank you very much. I'll do so. My next question to you, Dr. Miller. Now, this question might be a little bit sensitive, so just a warning for that. It has to do with relating to the morgue numbers. And I was wondering if you could just give the community kind of like an example or step-by-step telling them exactly what are the steps of afterlife care for COVID-19 related death for families to know what their choices are once a family member has passed with a COVID-related death. What are the choices and barriers?
Okay, interesting question, but difficult in some respects. What happens is that there are public health measures in relation to certain notifiable diseases and certain disorders. So there is, whereas say if somebody died from, say, a road traffic accident, there would be no obligation to give a formal notification to the Department of Public Health. They would know, but there wouldn't be a requirement to do so. In the case of someone dying from COVID, there is a requirement that has to be done. It's part of public health requirement and policy, and it tends to be the situation everywhere because the public health has certain commonalities. So the relatives are informed, and public health is informed, whether it is whatever time, day or night, the communication goes through to public health and is accessed by them. So that's the easy part of it. Now, like with anybody else, there is the process whereby any patient is pronounced dead. and so the body couldn't be moved for anyone unless that patient is pronounced dead and certified. Now, that having happened, the usual process would be for the body to go to the morgue, and it would be labeled in such a way that it can be easily identified. Now, what happens is that for some highly infectious diseases, one may have to handle the specimen or the body in a different way. The details of that would be with the morgue attendants and the people who work there. In terms of things like a post-mortem, for instance, if that were to be done, it required a special type of lab, special facilities, specially trained people. It's not the routine sort of thing. Now, the issue which I think you may be coming to, if I'm right, is the question of us having several bodies at the present time. And that is due more to a number of factors which the funeral homes have their own challenges. Some of it has to do with challenges that the families have in terms of the sort of burial that they would like. And so we're seeking the cooperation of the public as well as the funeral homes, the funeral directors, but also it does involve the churches because, as you know, many of the burial plots are owned by the churches. And so negotiations go on between the families, the funeral homes, and the churches, especially if someone were to be buried in a plot where, say, it's not their particular church. Say, supposing, just for argument's sake, the Anglican church at some place had 5 spots. Then it would be a negotiation as to whether somebody who was, say, AME or SDA or some other church, and that sort of negotiation and the details as to how they come to decisions, I'm not familiar with, and I wouldn't want to mislead you with the comment. So there's that side of it. But what happens now is that with the whole slowing down of the process, the funeral homes seem to have some challenges, and I can't speak for all of them, but some that I'm aware of seem to have some challenges. And so the best that BHP can do is to make sure that the bodies are stored in such a way that they would not deteriorate or decompose. So you have to use very cold temperatures. And by the way, you know, we have seen this sort of things in other parts of the United States. We've seen it in New York. We've seen it in Oregon. We've seen it in Ohio. We've seen it in Texas. So we wish we didn't have that same situation here. And although ours is on a much smaller scale, and I'm satisfied that it will be resolved with all parties working on it. And I know various parties have been working on it literally day and night. It's the sort of situation which is clearly distressing for all involved. And certainly my heart, my sympathies go out to all the families who are affected in this way.
Thank you, Dr. Miller. My follow-up to that would be that some persons are saying that they either have the choices in COVID-related deaths with families to either only have cremation and they cannot do embalming, and also that they're being semi-forced to bury them in clothing that they died in as well. Do you have any truth to this? Do you know if that is?
That detail I could not comment on, because what happens, for instance, in terms of whether there's embalming or not, that would be a matter for the funeral homes. BHP make no decision or comment on that. As to whether they opt for cremation or not, again, BHP make no decision on that. We do know that some people are in favor of cremation and some people are not. And we respect their choices whichever way they make it. So BHP doesn't seem to influence or to pressure people one way or the other. It's an arrangement between themselves and the appropriate funeral homes. What we do ask all the parties concerned is to see how they can make the process move along so that we don't really have a sad situation lasting too long.
Thank you very much, Dr. Miller.
Thank you, Maya.
My next
Next, we'll have Jonathan Bell of the World Gazette.
Good evening, and thanks for having us. Just checking that folks can hear me.
Yes, we can hear you, Jonathan. Thank you.
Well, thank you. I wanted to start with a question for the health minister. We're hoping to find out, in terms of our rest homes, how many of our rest homes still have outbreaks? Is there a number on that?
Hi, Jonathan. Can you hear me?
I can, yeah.
Yes.
Thanks.
Okay. Hi, Jonathan. There are 7 rest homes that are in outbreak. I believe a few of them are actually scheduled to be testing out in the not too distant future. What some of the steps that we've spoken about previously to try to address that, because we do recognize that it is a very vulnerable population, is to commence antigen testing of the staff whilst they're in outbreak, as well as the boosters. You would have heard me say that we are going to start administering boosters to the rest homes on Saturday. And if you don't mind, I just want to clarify something. That's Saturday, the 8th of October, and persons that are interested in getting the booster, they don't register for it. They go online and book the appointment, similar to how we book your test. So you go online, you book the appointment the Tuesday at 3 o'clock, et cetera, however you want to do it. That format, the program for the booking should be up by the end of the week, early next week. And if you are over the age of, if you're not over the age of 65 and your test is not younger than 6 months, you will not be able to book. So there'll be systems in place so that you can only book if you're over 65 and if your last second dose is over 6 months old, as we've indicated. So you go online and book. If you aren't tech savvy or you don't have access to a computer, you can call 444-2498 and select option 2, and they will book your appointment. So you're not effectively registered. You're literally going online because you're already in the system because you've already had your first and second dose. So you're literally going online and booking what date and time is convenient for you.
Got it.
Thank you for letting me clarify that, Jonathan.
Most definitely. This could be one for yourself, or it might be one for yourself, Mr. Premier. It's a question I do hear a lot. It would be great to reassure people, try and clear it up. It's regarding schools and the saliva testing program. Still some issues with that in terms of consent. The question hasn't been asked, and I'm hoping you can clear it up as to why people who have been given consent can't just come into school for in-school learning, and people who haven't given consent remain at home. Hoping you can clear that one up.
Thank you, Jonathan. I recognize the concern of parents. My children attend Northlands Primary, and we have not exceeded the 80% threshold. So this personally affects me as well. So it is not as though if I or the Minister of Education does not understand the concerns that which been raised. However, we're moving through this in a systemic fashion. What should be noted, the Minister of Education did state that schools that do exceed the 80% threshold for students to come back to school, they will need to show proof of negative tests. So even those students who do not test will not be able to enter the school and will be sent or be given and or providing learning packets. What I can say is that we're moving through this process. More and more schools are reaching the 80% threshold. We're continuing to work through the process as is, and if there's adjustments that are made when our situation in the country becomes better, that those changes will happen. I recognize certainly the concerns of parents. I am one of those parents as well, so I completely understand it. But we are going through a mechanism that we believe will ensure the best avenue for the safety of our students, both in the short term and also in the long term.
Thanks. I guess my final one is for yourself as well, sir. This outbreak is different from the others. I was just curious. I wanted to know what lessons you as a leader have taken away from this latest outbreak. Obviously, we're still in it. Metrics are going well, but what have you personally learned from it as being leader of the country during this?
It's incredibly hard to deal with death and significant. You take on, unfortunately, or naturally, probably as a human being, the stress and pain that is felt from the persons of whom you represent. So from that perspective, there is no doubt that it's being a challenging situation, and it's not been a situation that we would have liked or we would have envisioned. But it's just a reminder that the pandemic will continue. And one of the things that we've made clear is that as a country, we must learn to live with the coronavirus. This may not be our last wave. We are a country that relies on having open borders, and we need to make sure that all of us play our parts in making sure that we're responsible. And I think that's the thing that's most important. As a country and a community, it is important that we try to make sure that we remain as unified as possible to attack and to address the challenges in which we have. There are many examples of countries around the world who've been able to get rid of restrictions, do not have their hospitals overflowed because they, as a country, have come together and gone ahead to make sure that they have taken the measures to protect themselves against, to minimize the risk of serious disease or hospitalization, which is what the vaccine allows. And so it is just my hope that more and more persons will recognize that, the Minister of Health or myself or the Chief Medical Officer, Dr. Miller, or the doctors in this country or Dr. Brown or anyone else aren't trying to push poison, aren't trying to, be part of some fake pretend global conspiracy. We're trying to save lives. And it is incredibly painful. And, I recognize the anguish of the Minister of Health. I recognize the anguish of the cabinet colleagues. I recognize the anguish of the persons who are on the front line who have to deal with the strain, deal with the death, deal with the emotional strain of which the Chief Medical Officer has spoken about. So from that perspective, it has been a learning experience. But I think it's important that the country recognize that if we do not take measures into our own hands, if we do not pull together and to unify and not try to focus our lives on trying to tear people down, tear each other apart, question qualifications, do this, try to attack, that's not what we need right now. What we need is for as many people as possible to speak to their doctor, to get the protection, and for those who elect not to do so, to make sure that they are responsible in their interactions so they do not lead to the additional spread of this virus. And as I said, I think in last week's press conference or 2 weeks ago, a population that has 66% total population vaccination, more than 75% of the eligible population, you should not see this massive stress on the healthcare system, which we've seen. But it is because vaccinations and protections are not uniformly distributed throughout our community. And that's the challenge. So we're going to continue to press the message. We're going to continue to reach people where we can. I am encouraged by more and more people coming forward to say that they're going to take the approved vaccine, and we're going to work through it. So you asked what lessons I've learned. It's that this job is, without question, difficult. And it's not just me. It's the cabinet, it's the members of our caucus who have to deal with the results of the decisions of which we've made. And so from that perspective, I'm grateful for those people on the front lines. And I'm hopeful that we will not have another experience like this throughout this pandemic. And if we all do our part, I'm certain that we can prevent that from taking place.
Thank you, everyone.
Thank you, Jonathan, and thank you, members of the media. Premier, would you like to say a few closing remarks?
Thank you, Ms. Adams. I just want to certainly thank all the Minister of Health, Chief Medical Officer, and also the Chief of Staff for their continued dedicated work and effort. I'd just like to reiterate the message that the Minister of Health says. If you're interested in the booster, please do not go on the government website and register as of yet. Please do not. Those are for people who have not yet had a vaccine. So if you're interested in the booster, information will come out. Please do not go on the government website to register for the vaccine at this time. Please wait for information to be shared in the future for a separate site for booster registration. That is very important. I do not wish persons to go to the existing booster vaccination site. Thank everyone for their attention, and I would hope that everyone in the country continues to obey the rules and regulations in place. And again, I express my condolences for so many families who are dealing with the loss of loved ones due to the disease caused by this virus. So with that, I want to say thank you, Bermuda, and good